Welcome. Have you ever heard of a lung abscess? It's a serious condition that can develop in the lungs, but with prompt diagnosis and treatment, outcomes can be significantly improved. This video will explore the intricacies of lung abscess, covering its causes, symptoms, diagnosis, treatment. Let's dive in. A lung abscess, simply put, is a pus-filled cavity in the lung. But what causes this cavity to form? The most common cause is aspiration when food, saliva, liquids, or vomit enter the lungs instead of the esophagus. This is often seen in individuals with impaired consciousness, such as those with alcohol abuse, drug overdose, or seizures. Other causes include bacterial infections, particularly with anaerobic bacteria found in the mouth. Less commonly, a lung abscess can arise from blocked airways due to tumors or foreign objects, or as a complication of other lung infections like pneumonia. Certain medical conditions like diabetes can also increase the risk. Now, let's understand the process behind how a lung abscess develops. When bacteria or other infectious agents reach the lung tissue, they trigger an inflammatory response. This inflammation leads to the formation of an area of necrosis, meaning the lung tissue dies. As the infection progresses, this necrotic tissue liquefies and forms a cavity filled with pus. This cavity is surrounded by a fibrous capsule, which helps to wall off the infection. This abscess can then rupture into a bronchus, leading to the expectoration of foul-smelling sputum, or even into the pleural space, causing empyema. Lung abscesses are not extremely common, but understanding who's at higher risk is crucial. The incidence varies depending on the population studied. Individuals with predisposing conditions such as alcoholism, intravenous drug use, poor oral hygiene, seizure disorders, and those who have experienced stroke or other neurological conditions that impair swallowing are at significantly higher risk. Men are also more frequently affected than women, likely due to higher rates of smoking and alcohol consumption. The signs and symptoms of a lung abscess can vary in severity and onset. A common symptom is a persistent cough that produces a large amount of foul-smelling sputum. This sputum may be purulent, meaning it contains pus, and sometimes it's even bloody. Other symptoms can include fever, chills, night sweats, shortness of breath, chest pain, fatigue, and weight loss. In severe cases, the patient may experience hemoptysis, which is coughing up blood. It's important to seek medical attention if you experience these symptoms, especially if you have any risk factors for aspiration. Diagnosing a lung abscess involves a combination of clinical evaluation and imaging studies. Your doctor will first take a thorough medical history and perform a physical exam, listening to your lungs for any abnormal sounds. A chest X-ray is often the first imaging test performed and can reveal the presence of a cavity in the lung. A CT scan of the chest provides a more detailed view of the abscess, including its size, location, and any associated complications. Sputum cultures are also essential to identify the specific bacteria causing the infection and guide antibiotic selection. In some cases, bronchoscopy, a procedure where a thin tube with a camera is inserted into the airways, may be necessary to obtain samples for culture or to rule out other conditions. Lung abscesses can be classified in a few different ways. One distinction is between primary and secondary lung abscesses. Primary lung abscesses typically arise in previously healthy individuals due to aspiration or pneumonia. Secondary lung abscesses occur in individuals with underlying lung disease, such as bronchiectasis or lung cancer, or in immunocompromised patients. Another classification relates to the size and location of the abscess, which can influence treatment strategies. The primary treatment for a lung abscess is antibiotic therapy. Broad-spectrum antibiotics are usually started empirically to cover a wide range of potential pathogens, and then tailored based on the results of sputum cultures. The antibiotics are typically administered intravenously initially, followed by oral antibiotics for a prolonged period, often several weeks. In some cases, drainage of the abscess may be necessary, either through bronchoscopy or, less commonly, through percutaneous drainage, where a needle is inserted through the chest wall to drain the pus. Surgical resection, meaning removal of the abscess, is rarely needed but may be considered in cases of severe complications or failure of other treatments. Supportive care, including adequate hydration, nutrition, and pain management, is also crucial. Preventing a lung abscess involves addressing the underlying risk factors. For individuals at risk of aspiration, strategies include elevating the head of the bed during feeding, ensuring proper chewing and swallowing techniques, and avoiding excessive alcohol consumption. Good oral hygiene is also important to reduce the number of bacteria in the mouth. For individuals with underlying lung conditions or weakened immune systems, prompt treatment of infections can help prevent the development of a lung abscess. The prognosis for a lung abscess is generally good with prompt and appropriate treatment. Most individuals respond well to antibiotic therapy and drainage procedures if needed. However, complications can occur, such as empyema, bronchopleural fistula, or chronic lung disease. The long-term outcome depends on the underlying health of the individual and the severity of the infection. Recent research is focusing on improving diagnostic techniques, optimizing antibiotic regimens, and developing less invasive drainage procedures. Ongoing studies are also investigating the role of specific bacteria in the development of lung abscesses and potential new targets for treatment. By staying informed and proactive, we can all contribute to better outcomes for those affected by this condition.